Welcome back. We're talking to Britt Ballinger and Kristen Palmer. Both ladies are from St. Peter's Health. Thanks for joining us, ladies.
Thank you.
Thanks for having us.
Thank you. So Britt, we did have quite a conversation earlier, but I want to go back to a couple of items and just reiterate, how does a person's family history play into cardiovascular health? I think that's just important.
Actually, family history is probably the most critical risk factor for coronary disease, so it's important to know your family history. So for women, if you have a female relative under the age of 55, a first-degree relative, that's a mother, father, sister, or brother, under the age of 65 for women who has had a coronary event, then you're at higher risk. And for men, if they've had a cardiac event under 55, then you're at higher risk for a cardiac event as well.
Okay. So can you talk again a little bit more about the risk factors associated with poor cardiovascular health in addition to family history?
So again, family history is the big one.
Yes.
Smoking is a big one, and that one's totally modifiable. So if you have a family history, you really can't get away with smoking. Obesity, keeping your BMI in a healthy range is really important. High blood pressure, if you have high blood pressure, again, that's very hereditary, but it's also very controllable. Mm-hmm. So if you keep your blood pressure under control, then you can really modify the risks. And then high cholesterol, again, hereditary, but also controllable, and diabetes.
Yes. Tell us how smoking actually contributes to cardiovascular issues.
Over time, nicotine can constrict the blood vessels, and over time they become stiff. And also raises the blood pressure, so the consequences of high blood pressure are just kind of magnified with smoking and nicotine. And they put pressure on the lungs, and it all works synergistically, so
Sure.
Smoking really raises your risks of cardiovascular disease as well as pulmonary disease, which puts pressure on the heart.
Thank you. Kristen, to you, good morning.
Good morning.
Let's talk about sedentary lifestyle and how that really does contribute to issues with cardiovascular health.
Britt talked about that it is a risk factor, and I think especially in our country we've kind of had more inactivity in our lives as time progresses. Mm-hmm. So having a sedentary lifestyle actually doubles your risk for developing diabetes and obesity and cardiovascular disease. So it's really important to be able to exercise and to practice that exercise most days of the week. So I tell our patients that it's just like brushing your teeth or bathing every day. It's part of taking care of yourself, and exercise is a very important part of that. You wouldn't go without brushing your teeth, so you shouldn't go without exercise.
That's great advice. One thing we haven't talked about yet, and I'm going to turn to you, Britt, and that is stress. It's so prevalent in society, and I think it's important for our viewers to hear about how stress can negatively impact cardiovascular health.
Mm-hmm. Stress is definitely a risk factor. Those type A personalities, we definitely see a lot more of those in our cardiology office. So if you are a type A person, you need to figure out ways to control your stress, and exercise is actually the best way to do that. Everyone has different things that works for them to control their stress, but exercise, just a 30-minute walk, is known to reduce stress.
Excellent, thank you for that. Kristen, I'm going to come back to you and talk a little bit more about diabetes and how that actually negatively impacts cardiovascular health.
Well, the most common way that it does for cardiovascular health, most specifically coronary artery disease, is it encourages the buildup of plaque on the interior lining of your arterial walls, and cholesterol and plaque. So that creates a narrowing in the coronary arteries that feed the heart muscle with blood and oxygen and nutrients that the muscle needs. So you actually have that increased risk of having a heart attack with diabetes. The other thing is especially with type 2 diabetics, is that they often have other coexisting risk factors for cardiovascular disease, like obesity and high cholesterol and high blood pressure. And so all those actually increase the risk even more for cardiovascular disease.
Okay, great. I'm glad that you hit on obesity. That's important. So Kristen, I guess in follow-up too, so healthy diet can help prevent cardiovascular disease to an extent. And what would you recommend diet-wise for cardiovascular health to our viewers?
I think number one is portion control. And you know, we only need as much food as we're expending, really. So especially if we're having living a sedentary lifestyle, we don't need to eat as much. But also having a variety of foods, fruits and vegetables of multicolor and lean proteins, fish and poultry and the leaner cuts of the beef. Incorporating the healthy oils and the nuts and stuff like that. And then also when you're shopping, learning to read labels on what you're buying and staying away from the sugary foods and high sugar beverages and you know, keeping an eye on your sodium and your fat intake. And you know, going along with the sugary beverages, you know, it'd be better for you to eat an orange than to have a glass of orange juice, you know, because you have there's bioflavonoids in the orange and other phytonutrients that are good disease-fighting nutrients in that. Plus you have the fiber in the orange. So just staying away from those sugary beverages.
That's great information. Thank you. So Britt, we have time for one last question before we have to go to break again, and I think this is a really important one because it's so prevalent in our society, and that's alcohol. How does alcohol negatively impact cardiovascular health? Can you talk about that?
You know, it's all things in moderation. Especially if you have already been diagnosed with heart disease, then it is a bigger issue. It can definitely lead to cardiomyopathy. So the recommendation is that two alcoholic beverages a week for females and for males, which isn't really fair, but that's just sort of how it works out scientifically.
Yes.
Yeah, but yeah, it kind of is an individual thing.
Okay.
But once you've been diagnosed with a heart issue, then it's a bigger deal.
Okay. Thank you. Thank you, ladies. We're going to take a quick break and come back and visit some more after that. So hopefully you'll stay with us. Right. Up next, we'll be talking about cardiovascular rehabilitation. We'll pause here for a short break, and we'll continue this conversation after these messages. Stay with us.